Hello, everyone, and welcome back to Bridge Builders Academy. Today, I'm going to cater to the most requested topic, health informatics in the United States. And this is the first time that I have reached out to someone who is not from a medical or dental background. For those of you who have this confusion in mind, that this field can be pursued only by clinical professionals. So, to discuss and understand the scope in the field of health informatics in the United States, we have with us Ms. Palak Rajoria, currently working as a data analyst with Mount Sinai Health System, New York. She completed her bachelor's in hospital administration from Indore and a postgraduate diploma in computer applications right after her bachelor's. She then enrolled in the Master's in Health Informatics program at the Indiana University, Purdue University, Indianapolis. During her internship, she worked as a data scientist at the state of Indiana. Despite not having any work experience in India and coming to US as a fresher, she was able to achieve what she desired of by learning new tools, expanding her domain knowledge, and diligently applying to positions of interest. So let's understand the scope and opportunities what this field offers. Hi, Palak. It's good to connect with you over LinkedIn, and it was amazing to look at your profile. I really wanted to have a session with somebody who's done health informatics in the United States and is working in the field, and I landed upon to your profile. So thank you so much for accepting our invitation and talking about this field in the United States. It's
Yeah,
amazing
thank
to
you.
have you.
Yeah, thank you for inviting me as well. I just went through the few videos that you posted and I was really interested in giving this interview because I know when I came to US for health informatics, there were very few videos or Google Docs where I could just go in and see what universities are available, what are the courses available. So it's good that you're making such videos so that more people can see what the domain looks like, if it really relates to what they're doing, if they're really interested in the positions that we offer in this domain. So it's good to be interacting with you.
Thank you. Thank you so very much. So, before I start with the formal discussion around the field, I would just want to know like what made you or what was the interest that how did you develop your interest towards this field in United States? And I look at your profile, you come from a hospital and healthcare administration background. And then you also did some programming, courses. And then I think you landed up with health informatics. So how was this trajectory and how did you came to know about this field?
Okay, so to be very honest, while I was pursuing my bachelor's in India, I did my bachelor's in hospital administration. So this was an integrated course. This included BBA and MBA. But while I was pursuing my bachelor's, I just realized that there were very few hospitals that were paying good in terms of where I was working in. So if I work as a healthcare management um, consultant or maybe a healthcare manager in a hospital, the pay is not quite that high. And so mainly the thing that brought me to health informatics was the earning potential in the field. To be very honest, the second would be, since I had the background in healthcare, I did my bachelor's, I took biology, I knew what the field is about. It's just that since everything is moving towards information technology, now that information technology is occupying every domain, I thought that it'd be better if I gain some of the skills in the field so that I'd be able to apply it to the healthcare for improving patient outcomes or improving just their patient stay, since I come from the healthcare background. So I think these were the two options. And the third one was, since this is a very versatile career option, I can be a EHR personnel, I can be a data analyst, I can be working as a management, continue to work as a manager, but I have technical expertise in my field. I can work as a business analyst. So I think it was very diverse. I had a lot of career opportunities here, and then the earning potential was great. So that is what helped me to get into health informatics.
That's amazing. That's really good to know. So, can you enlist some, important key points that one should keep in their mind while they're applying for health informatics masters? Usually, like, what I've seen is people, most of the students, they want to pursue MS in health informatics in the United States. So while the application, what are the key points that they should keep in mind?
Okay, yeah. So starting with a very basic, do a lot of research. See what exactly you are interested in, because I'd say most of the audience that here will be visiting us, I think they'll be more from non-technical background. So that is BDS, pharma, management, or maybe other clinical courses that they have done in the bachelor's. So I think since you're coming in a very technical domain, you should be very particular about if you are interested in it. So don't just take it because it is a very booming career or everyone in the healthcare is now taking health informatics. Do your research. There are other options as well, like public health. If you're not really a technical person, you may pursue the other options as well. So do your research, know exactly what career track you would want to take. Then coming to the universities, shortlist some universities, what locations you would like to come in the US, if there are any career tracks provided by the universities. So just do a lot of research first before doing any applications. And then I'd say for shortlisting universities, just aspire for 2 universities that is something that that you may or may not get based on your profile. So I'd say it's an aspiring or a overachieving university. So shortlist 2 or 3 of those universities. Shortlist 3 or 4 universities which are like you will be very sure that you'll get into it. So just 3 or 4 those, and then 1 or 2 safer options. Like you might not go there, but then just as a safe option, you may choose that. Then I'd say connect with the people from all of the shortlisted universities, ask them questions like how is the universities, how's the curriculum, how's the placement record, have you been able to get internships, how are the professors. And then I think last would be to see if there is any WES evaluation. So okay, so when I started applying to universities, there were a few universities which asked for WES evaluation, and that is just changing your Indian transcript to the US accepted transcript. So it's like since we have CGPA and percentages in our transcripts, it's just converted to GPA format. So you'd see if a university requires you a WES evaluation, only then do it. If it's not, then don't waste your money on evaluations. And I think just don't depend on consultancy so much. There are consultancies in India. Do your research, ask alumni, shortlist universities yourself. And I think that's how you can choose a health informatics track in US.
That's amazing. These are really, really important points. Now, when you say shortlisting universities, I had a lot of questions in terms of which are the universities, where we can apply. So how do you get that list? Is it just through Google search, or is there any portals like study.com is a good portal that I think of when anybody is trying to apply for any kind of an overseas education? Are there any other platforms that you are aware of?
I think study.com is the one. And then I think I rely more on Google, because on Google, you just search up top 5, top 10, top 20 universities. And then it will give you on basis of the expenses that each university you would have to incur. So I think that's Google would be very better than any other specific, because I think you'll have to know the location of the university. You'll have to know what expenses would be required. And then maybe you can see the ranking of the university. So I'd say, yeah, you can search at different websites and just shortlist what's been occurring on most websites, and then speak to the seniors.
Okay, that's amazing. That's great. Yes, I think that should be a good point to start for anyone. So when you
Yes.
land onto a master's program in health informatics, what should one expect? Like, how is the college life, and how is the curriculum? Is it too hard? It is too technical for somebody, say, coming from a, like you said, non-technical background? A doctor pursuing a health informatics, how easy will it be for them to comprehend with the subject?
Okay, so for this, I'd say that be ready to face an environment where practical knowledge or applicability of the concept is given more importance than just mugging up something. So you'll have to be very practical driven. You should know what you are studying in a course. It's not just about mugging up something that the professor has taught at the university. You will have to choose your electives wisely. I think since people are coming from non-technical background, they might find it difficult to deal with the technical courses, but don't shy away from it. You will, since you're entering in a health informatics, which is basically healthcare blend with technology, you will have to know technology in order to get a good job.
Correct.
So it may be that you may not have to master it, but you'll have to know the basics. So I think just choose your electives wisely. Do ask your seniors, take feedbacks about the course, the professors, or how are the professors teaching those electives, and then keep track of the deadlines of taking the course. Because I've seen many students, they miss the deadline, and then there are very few elective options that may not be very relevant. I think that should not be done. You should keep track of the deadlines so that you can take good courses beforehand, and then start looking for internships after the first semester. Although you'll be allowed to work only after a year of completion of your course, but I think after first semester you should start looking at it, because then you will know what career options are available. You will know what your interest is in, since you have already completed a semester. You'll know if you really like maybe some technological tool taught in your first semester, or maybe you dislike something, so you wouldn't enter that field. So I think after your first semester you become that sensible, that you know what you don't like. So I think that'd be good to start, and then stay current, do good projects. Like every semester in every course you have to complete a project and submit it to the professor. It may be a group project or it may be an individual project. Whatever it is, just try to choose a good subject, stay current in that, see what projects are being pursued right now. Like for example, if you are interested in machine learning, for example, just see what kind of projects right now on Kaggle, or there are different resources online where you can just get some data, and then you can also have some example of how somebody else has analyzed it. So you can just go up, Google up something, and then see what your interest is most in, and then take a good project theme.
Okay, okay. I think this is really good to know. And when it comes to technical languages, like learning any kind of programming language, for example, SQL or maybe R programming or Python, how proficient one should be in these programming languages?
I think you don't have to master a particular programming language. So you have to be a jack of all trades. You should know SQL basics, you should know Python basics, you should know R. If you know a language basic, you will be able to code in any language. So Python, R, or anything. Mostly in healthcare, for my background, I'm using R. But previously in my internship, I used to work on Python. So it's like, it depends on the company, but you should know Python, R, SQL. Then you should also know some data visualization tools like Power BI, Tableau. So I think you should know the basics of everything.
Okay, okay. I think that's good. And how does a career profile looks like? Like, what are the various sectors or opportunities that one can seek while once they have completed their course?
Okay. So for the career opportunities, I break this down to three parts. You can apply to three kinds of domains. First is public health agencies or universities. So public health agencies would be the government departments of, so like a healthcare department of a state. So New York State Health Department, New Jersey State Health Department, like there's every state has a healthcare department. You can apply to those departments, or you can apply to public universities. So like my university was a public university, which is Indiana University. It had IU Health, which is also a agency which might give you a good pay in terms of data analytics, healthcare data analytics. Second is non-profit organizations. So non-profit organizations would be healthcare hospitals or firms. Like in New York, I'd say Mount Sinai. Then there is in New Jersey, it's RWJ Health. There are different kinds of non-profit organizations all over the US. And then the third is the private firms. So private firms would be like pharmaceutical companies, insurance companies, or data analytics firms. So specifically healthcare data analytics firms. So you can apply to all of these three. and then see for yourself what works best for you. I'd say start with internship. You should try getting a good internship in any of these and then see how it works for you. If you'd like to work in public health, so public health requires different expertise. A private would require you a different expertise, like require you more proficiency in maybe data analytics tool, high level data analytics tools like machine learning, AI. You should know all of these. But in public health, it's mostly like analyzing the healthcare patient data, or maybe for a government, they'd want to know what's the mortality, what's the mortality, or like basic things like what's the death ratio of the state, what's the birth ratio of the state. So like it's very basic. So it's like you're visualizing something, or you're giving them a dashboard for their website. So it's like that. So you have to I think internship will be a good start to understand where you would land up, you would like to land up in the future.
I think that's good. And the what are the different profiles that one can look into? Like when I did my master's program in health informatics, I started with working as a business analyst, wherein my
Okay.
basically around the requirements gathering and documenting the requirements documentation and creating wireframes and all of those things. So what are the different types of profiles that one can choose? I think are working in data analytics, so you work as a data analyst, right? Similarly, there are other on the functional aspect of the product, what are the profiles that one can look at?
Yeah. So basically, first is analyst. So analyst can be business analyst, as you said, data analyst, data scientist. Second is EHR specialist. So you work with Epic or Cerner. It's basically pulling out data from EHRs and then using SQL. So this is like most rudimentary form that I'm saying. So EHR, it could be anything, but just pulling out data from the databases. And the next would be project or product manager. So project manager, product manager would be something who would be working on a particular healthcare device. Maybe they're working on building some new device, or they're working on specific projects in a company. Then there'd be data coordinators or data researchers. So data coordinators and researchers basically pull out data using SQL from different databases, and they send to the analyst for analysis. So these are like different domains where you can apply to. And then I'd say that while pursuing your first semester or second semester, I think you should be able to take up courses, at least one courses in each of these, so that you know where you would want to land up in future. So for example, I took up a language course. So that was R, data analysis with R. So while doing that course, I just found that it was more interesting for me. So I continue to build up that skill, and then I applied to data analyst roles. I also took project management as a core subject. So in my university, it was a core subject, but you could take up as an elective if it is not provided in your university. So after doing project management as a course, I found that no, maybe I'd like to stick with data analysis and not go into project management field. So it's like it's based on your own like skill sets. What would you like to take up? They were my different like most of my friends also took EHR specialist. They went on becoming specialists in EHR, pulling out data from EHRs. Some became project managers. So it's like you take up electives in all of the subjects and then decide for yourself.
I think that's a good thing to start. So you have options, in each of these categories that one can choose, and then they can identify which one they relate to and then build their career.
Right.
I think that's a good
Yes.
to go about it. And yeah, I think that's nice. So you can choose all of these domains, or you have to select like generally electives are like choose 2 or 3 options, something like that.
Yes, so in mostly universities offer 2 to 3 electives. My university offer 2 to 3 elective, and then like some subjects are core subjects. So maybe for health informatics, mostly universities will have languages as core subject. So data analytics you will learn as a core subject. For example, if you want to learn something else apart from data analysis, you will have to take it as an elective.
Okay. I think that's good. And I think in US already, like here now in India, we are starting with the adoption of systems. In US, I think this all adoption started way back in 2010,
Yes.
around that Obamacare, and now they have almost like 85 to 90% of the hospitals and physicians are using electronic health records. So they are no
Mostly every.
I think for them the buzzword is more around interoperability and data analytics and artificial intelligence and machine learning, right?
Exactly. Yes, that is true.
That's amazing. So how can one find these opportunities? Like in India, we have campus placements kind of a scenario. Do
Yeah.
the universities in US they also offer the same thing?
Oh, I wish. No, but no. They don't offer any campus placements. They offer something like fests or maybe career opportunities where you would just walk into a place and where there'll be different um career experts or people representing a specific company. You would have to walk in there, show your resume, provide them your details, and they might reach back to you based on your resume, or if they liked speaking to you just in general. So I think they offer that, but you have to be very you have to be on your toes when you apply to companies here in US. I think it starts from as basic as applying to internships. So if you've got into a good internship, I think getting a good job won't be hard for you. So I'd say it will start after your first semester itself. You should start looking for internships, and it should be as rigorous as you're looking for a full-time opportunity. So if you are able to get an internship, try converting it into full-time. That'd be like the best thing that you could do. Since the market here in US is a little, it's not quite stable right now. So I'd say it's better that you get into a good internship first and then you convert that internship. Or if you've already done an internship, I'm sure no like agency would be reluctant in hiring you. So I'd say connect with seniors or students that have already worked in certain company that you are interested in, that have worked in a particular domain that you're interested in, and ask for their feedbacks about how they have applied, what practices have they followed, how to tailor your resume based on that specific company. And then second would be try converting your internship to full time, and then apply not just on LinkedIn or Glassdoor or I think Indeed, but also apply on websites of particular company. So go to government websites. Like for example, I applied to my internship place by going to a government website. So I worked as a data scientist intern during my third semester. And I found that internship on the Work for Indiana website. So, like similarly, there are websites for every state where you could just go in, click on the career options, and see if they have a particular position available. If you find a position available, go to LinkedIn and search for that position in the people's. See who's working in that company. Just speak to them. And I think here is where most people go, most students do the wrong thing. They just message them asking for a reference. I think you should never, never do that. You should first go speak to them, introduce yourself. First would be to introduce yourself, send your resume to them, and then ask if you have specific questions like I'm interested in this position in your company. Would you be able to tell me more about the position? Are you aware of who is the hiring manager? I'd like to speak to someone who is who has posted this job role. And then you would just ask them basic questions, and during the process introduce yourself. They should be really interested in you before giving any reference. They won't give you reference if they're not interested, or if your resume does not match that position. Don't just go and ask for resume for the reference to anyone. I think that does not work here.
Right.
I think that's how you'd be able to get a good position. And although there's no such thing as 100% placement in by the university, you'd be able to place yourself in a good university, in a good job role if you follow these steps.
I think that's good. That's really good. And like you said, LinkedIn, there's another point that I would like to add in here. When we connect with somebody on LinkedIn, there is a option of add note. So if
Yes.
you can use that and start the introduction thread from there itself. I think
Right.
that's way to start rather than just
Yes.
sending. Sometimes even if I get a message from some maybe students or somebody whom I completely don't know, if I have that note, I still would be accepting the invite. Otherwise, I
Right. Right.
ignore the invite. So
Yes, that happens to me as well. Like, since I've recently graduated and I'm working full time, many of my juniors or people in the same domain, they would just message me directly asking for reference. Like, sometimes I feel very sorry for them that I won't be able to do that because I don't know the person. I won't be able to refer you. It also harms my credibility. I won't be able to maybe refer someone in the future if you're not as potential a candidate for that job role. So I think first introduce yourself, give a brief background of your projects, send them the resume. Know you'd be able to know if a person is really interested in you if they're replying like in on your thread. So like asking for reference should be your last step.
absolutely correct. Absolutely. So all your audience, I hope you have written down these points somewhere. She's given amazing points that you should know of while you're applying, when you're in college, and then how do you seek out opportunities in the United States. So I think for you audience, just make sure that you have these notes written down, and then if you have other questions, you can always connect back to Palak. I will share her LinkedIn profile in the description for your reference. So,
Absolutely, yes, I'd be happy to help.
yeah. Any last thoughts or advice that you have for the audience?
I just say that since most of you would be coming from a non-technical background, just don't shy away from taking technical courses in your curriculum. That will help you at least to know if you're really into that subject, if you like it or you dislike it completely, or maybe over a period of time you'd be able to develop your interest. Since because for me, when I started from in my first semester, it was the first class that I sat into was Python, and then it was so difficult for me to grasp anything that was taught in that subject that I felt like I don't know if this career opportunity is something that I should have taken. So I really questioned my decision. But then slowly and steadily, when I tried to learn the concept through YouTube, through Udemy courses, Coursera courses, or maybe just reaching out to professor, telling them that you're not a technical person and you're not able to get the subject in the way they are teaching. So I think you should be very open about it. None of the professors here would mind anything. So they just provide you more resources. Maybe they just provide you a more basic version of what they're teaching. And if you go through it, you'll be able to understand things. So I think it'll be maybe not very, I'd say it'll be a little difficult for you initially, but then don't shy away from it. Try learning as much as you can. I'd say do good projects it because in while giving internship interviews or full-time opportunity interviews, you'd be asked questions based on your projects. So mostly everyone will ask you what projects have you pursued, what kind of programming or data analytics tool you used, what was the result. You'd be able to tell them everything about your project from the basics to the advanced. So I think just do good projects, stay current, take data from Kaggle, build a dashboard, or just do something with the healthcare data or clinical data so that when you come up speaking to someone, you'd be able to share what you've done already. And then connect with people online or on LinkedIn. Just ask them what skills to gain. If you know something already, just ask them how could you advance in that. What tools do you particularly use in your field? So you could ask people about general questions like what skills to gain, how could you tailor your resume based on some job interview or some job role, and then how to give a good interview. So speak to as many people as you are able to, do good projects, and I think take good electives. That'd be my last thought.
So you've compiled everything, the entire conversation in a snippet for the audience. And thank you so much for, sharing all the insights. I think wonderful points that many were actually asking me, and you've answered those questions. So thank you so very much, Palak, for coming on our platform and talking about the field, the opportunities, and how can one start in this area. So thank you very, very much.
Thank you for inviting. And if any of you would like to speak to me about anything, maybe a job role or electives or just choosing a university in general, I think she'll put my LinkedIn down below, and then you can just reach out to me. That's absolutely fine.
Sure. Thank you so much. So, all your audience, I hope your questions have been answered. And thank you so much for patiently listening to our session today. I hope if you have any other questions, like Palak said, you can connect back to her. You can connect to me if you have any other questions and you want me to connect to her and all of those things. So we can do that. Thank you so very much for patiently listening to us today. I will see you in the next video. And before I sign off, please subscribe to the channel. It's absolutely free. Like and share this because this might help out most of the people who are now looking for health informatics in the United States. So thank you so very much. I will see you in the next video. Until then, bye and good luck.